evening. I'm really pleased to talk about the Biomedical Engineering Department here at Washington Hospital. I'm going to tell you what we do and who we are. But first, I want to tell you about our field. Our field goes back to an article that was in the March 1971 version of the Ladies' Home Journal. This article was written by Ralph Nader, and in it, he claimed that at least 1,200 people a year were being electrocuted in hospitals. It proved that his facts were wrong, but it raised awareness of the issues, and our departments were started. Things like this rarely happen nowadays. So Washington Hospital originally had joined a group that provided shared biomedical services. The program over time evolved and became part of an independent service provider, a contractor. In April 1998, the hospital decided to bring the department in-house. Sometimes the perception is that equipment service or servicing is easy. If we do our job properly, it really should be as easy as that. But it's not. And what we do is we provide engineering services to a clinical environment supporting technology, clinicians, patient technology interface to reduce risks, improve patient outcomes, and enhance patient care in a cost-effective manner. So what do we need to know to be a biomed tech? We need to know anatomy and physiology, medical terminology, safety in healthcare including codes and standards, fundamentals of electricity and electronics, medical equipment functions and troubleshooting, information systems, and most of all, good customer service. In the certification exam, some of the things they cover are anatomy and physiology. We cover systems, organs, blood. We also cover safety in healthcare environment. We cover electrical, chemical, radiation hazards, biological, and fire, and all of the codes and standards that pertain to those. We also cover the fundamentals of electricity and electronics. We have to know transducers, the different conversions and calculations, electronic devices and circuits, test equipment, batteries. And most importantly, we need to know medical equipment. These are some of the systems that we need to know. Monitoring systems, portable equipment such as infusion pumps, life support equipment including anesthesia machines, therapeutic equipment, laboratory equipment, diagnostic imaging equipment, operating room information systems, and all the special test equipment that we use to service those. We also need to know how to troubleshoot those systems. All the same systems I just talked about, they all have their own separate idiosyncrasies, and they act up different ways. We need to know how to troubleshoot it. We need to know how to talk with the caregiver to understand what it is that's really wrong with the devices. Some of the regulatory bodies that we need to know about and know the codes and standards of are listed here on the screen. So our mission statement says that we are to ensure the electrically safe and functional equipment for patients, visitors, hospital employees through a program of continuing inspection, testing, and repairs of patient care equipment, regardless of ownership, and we assist with in-service training. We act as a resource in selecting new patient care equipment and fulfilling manufacturers' recalls as needed. Our main customers are the direct caregivers of Washington Hospital. Other customers include the support departments, patients, some of the DevCo sites, administration, and regulatory authorities such as the Joint Commission and the Department of Health Services. Some of the services that we offer are pre-purchase evaluations and consulting. We use several outside resources, including MD Bylines and ECRI. We make equipment recommendations. We help with purchasing. We recommend service options, including manuals, service media, training classes, and specialized test equipment. We do incoming inspection on every piece of equipment. We service the equipment. We have thousands of parts in stock, and we have the specialized test equipment to test it. We provide some loaners, and we help contract management for service contracts. We help negotiate the contracts and administer them. We do user in-service training. We do regular preventive maintenance, safety, performance testing, and calibration on the medical equipment. We do corrective work orders or repairs, and we do presentations